Well, welcome everyone. Well, it's a great day. The sun actually came out. It was kind of gloomy this morning. The sun came out. We're here for a couple reasons today. Number one is to dedicate our new expansion of the South Tower. That will include a new emergency department and a new inpatient unit. But secondly, it's a rebirth of our organization. Not only the expansion, but the changes that we've gone through in the last year and the changes we'll be going through in the future. It's been a great year for us. We've made lots of changes, lots of improvements, and this is just part of that. Over the last 4 years, we've worked to improve our inpatient population care. We've expanded and renewed the entire North Tower. We just dedicated last week our new cath labs and our open heart surgery unit. So we just continue to expand and renew ourselves, and yet this will be sort of the culmination of renewal as we expand our South Tower. So with that in mind, I'd like to introduce the mayor to us. I do welcome all of our dignitaries, all of our employees, board members. Without everyone in the community supporting us, we would not be able to do what we need to do. But more than that, it's to be able to care for the patients of our community and of the Mid-Ohio Valley. So, Mayor, I'd like to introduce you to say a couple words.
Mr. Brennan already said that if I brought sunshine, I could have 3 minutes. Probably pretty good. You know, I'd like to do something a little different today because I'm not going to really talk about hospitals. I'm going to talk about us and where we live. And if anybody remembers Fred Rogers, he used to be Fred Rogers, this is your neighborhood kind of thing. He had sort of a jingle that he started the thing, and I would like for you, I'd love to see all these ladies here because I know you'll support with me because I can't sing. Anyway, I like to sing the first couple things in relation to this, and I will give you the words first of all. And the words are, it's a beautiful day in the neighborhood. It's a beautiful day in the neighborhood. I hope it's ours. And we're going to do the second thing the same way. It's a wonderful day in the neighborhood. Come on, you can do it too. And it's a wonderful day in the neighborhood. I hope it's ours. Wonderful day in the neighborhood. I learned, I got the sheet music for this, and I listened to him sing 3 or 4 times, and he never followed the sheet music, so that was okay. So I'm going to start out again. It's a beautiful, you sing with me again. It's a beautiful day in the neighborhood. It's a beautiful day in the neighborhood. I hope it's ours. Second verse again. It's a wonderful day in the neighborhood. It's a wonderful day in the neighborhood. I hope it's ours. And you all know this wonderful expansion is in our neighborhood. I mean, we're looking at a $20 million plus expansion over my shoulder, 60,000 square feet to go along with what David has already outlined. And, you know, the future is really wide open for everything. And down the line, Mr. Rogers says this. Since we are all here together today, we might as well say some beautiful things by thanking all the people involved. I'm going to start out with David McClure, CEO and President of I'd like to thank the West Virginia United Health System. I'd like to thank all the doctors. Give yourself an applause, doctors, please. All the nurses, all the staff, we can give them an applause too. Anybody who is involved in making this institution better for everybody, and that's our community. You know, for the city of Parkersburg, I'll just tell you something. How many of you have ever gotten a new car? You got a new car lately? Are you proud of it? You like to show it to your friends? Well, I'm going to tell you something. I'm proud to say this hospital is ours. This is our hospital. And when you try to entice people coming into your community, you know, you talk about schools, you talk about people, you call wonderful people, you talk about health care. You know, I read in yesterday's paper, and they're talking about the cracker plant. And the newspaper headlines are typical newspaper headlines. I don't mean that in a bad way. But I mean, it's like it was this morning. It's overcast, it's gloomy. But what did it turn out to be? So, I believe Governor Tallman when he says the cracker plant is coming. And I believe as mayor, it's going to happen. I think you'll probably see some transfers in the paper at the end of this month a little bit. But I will tell you one thing. We cannot dictate to a mega billion-dollar company like that when to build that plant, where to build that plant. We just hope it's ours, and we're going to work like heck any way we can because we need jobs. And it's very good for that. And also, as a mayor, I would like to talk to you about the future of an area, and the future of the area is based on healthcare. I believe all the jobs that are in this area, we have to keep promoting that. And for David, I tell you what, David's in a great position here because of all the expansion he has done in the last few years and what's on the table. He can actually say to people, we are on the cutting edge, and with this facility here, I believe emergency rooms still put most of the people in your beds. I think that's been the history of emergency rooms, which is good. That's what hospitals are for. But David's like a riverboat gambler. He's got the old ace up his sleeve. And the old ace up his sleeve is this expansion, because in today's world, government are trying to tell doctors what they can earn, where they can be, and stuff like that. Well, what's left for the community, for us, we have to say, hey, nice people, good thing. David has to say, yes, we have that. We have good paying positions, but we have state of the art hospital to work in. A doctor coming from out of the area would like to work in a state of the art facility. It's like buying a new Lamborghini. You know what I mean? It'd be nice to be driving. That's what Kevin White, the wide receiver from West Virginia, bought when he went to Chicago. But anyway, David, again, I'd like to thank you for your tremendous expansion. I want everybody to understand something. This is your hospital, and this is our hospital. It's my hospital, but it really is our hospital, and it's located in our community rather than somebody trying to pick up this whole complex and put it 5 miles out in the country. We are here in the center of Parkersburg, where 40,000 cars pass this place every day. I mean, to be honest with you, we're very fortunate to have this hospital, this location for our city. So thank you all very much. God bless you.
I do want to go back a little bit. Let me go back 3 years ago when we started this process. 4 years ago, we merged the two hospitals together. And during that process, we decided that we needed to modernize one of the facilities. We looked at the location of both facilities, and we looked at the structure of the two facilities and made a conscious decision that we would modernize the facility here in the downtown area. It was not without a lot of decision and a lot of work, including the Pickering associates, that helped us make that decision. So fast forward to a couple years ago when we decided not only to modernize the North Tower, but to expand our South Tower. And part of that was to involve our clinicians along with the experts that do architectural and engineering work to be able to design this expansion. And so we brought all of our clinicians together. We wanted to make sure that they were at the forefront of designing this new expansion, and then asked the Pickering associates to join us. Worked very hard. We actually brought people in from outside of our area to help us with the design, and ultimately what we came to was a very nice flow design for a brand new 43-bed emergency department that will have 3 trauma rooms, high acuity patient care areas, and areas for our ambulatory patient population too. We then decided that with the modernization of the hospital, more and more patients would like single rooms. And so we decided to add 30 additional rooms to our physical plant that would be all state-of-the-art private rooms. What that will do for us will not only provide those private rooms, but it will also provide us the opportunity to go back into the North Tower where we have many semi-private rooms and convert those to private rooms also. And really, we are here to service our community. We're here to take care of our patients. We are here to be on the cutting edge of healthcare for our community. And all of the modernization, all the money that we put back into our community and our facility is really to relation. help our doctors, nurses, and all the rest of the ancillary services take care of those patients and ultimately be good stewards of this community and good stewards of the Mid-Ohio Valley. So beyond that, we are working very closely with our trades. Our goal is to be able to complete the project by fall of next year, hopefully sooner, and to be able to have a great new addition to our South Tower. So we've talked a lot about the physical plant and the services that we've provided. I'd now like to introduce Dr. Kalinda, who's the President and CEO of West Virginia United Health Systems, and to talk a little bit about our relationship, but also talk about the rebirth of our organization and our system at this time. So Dr. Kalinda.
Good morning. Mr. Mayor, I'm not going to ask people to sing again. But if I were to ask people to sing again, it might be Country Roads, which you don't want to hear me sing. I want to thank David for inviting me down. I want to thank Dr. Capel and Ms. Eddy, who have been stewards and leaders of the board here, and all of the staff who provide care to patients who cross our threshold every day. And that's what we're about. We are about a healthcare delivery organization that wants to deliver state-of-the-art care for our regions and our communities. And I think that as this is perhaps the most exciting time to be in healthcare. Now I know that some of my physician colleagues might challenge me a little bit about this, but I think that we are at the intersection of dynamic changes in biological medicine that's coupled together with information technology, that's coupled together with a new conceptualization about team-based medicine. And that when you think about emergency rooms, physicians work with the healthcare emergency room team, and investing in our front end of our access to our care system is a very important thing that we do and that we must make a commitment for. And so when you think about a regional health resource like we have here at Camden, you need to understand that we touch the lives of so many people, whether it's delivery of children and newborns all the way to post-acute care and end-of-life care. But the anchor to the care delivery system has been and will continue to be the hospital. And Camden will be that anchor for this region of the state. And we are very proud to be part and parcel to that trajectory moving forward. Camden now is part of a larger organization. It's the West Virginia United Health System. As I like to say, we span from the Potomac River in the east to the Ohio River in the west, and I think that's about 400 yards that way. But I used to say we have an outpost north of southern West Virginia, but actually it's Gasaway. So we move and we have affiliations with colleagues in Maryland, and if you look at our state, we have the good fortune of being the largest healthcare delivery system in the state. And our strategic plan moving forward is to be an integrated health system, recognizing the importance of primary care, community-based specialty care, moving into pre-acute care and the acute care arena, from critical access hospitals all the way up and inclusive of a quaternary tertiary care center that we have up in Ruby. And then we're seriously taking a look at post-acute care. And for those of us who are in my own background and discipline is in geriatrics, so for those of us who have been in post-acute care for most of my professional career, looking at the post-acute care, long-term care, palliative care is also a very special responsibility that we have as a healthcare system. So in thinking about where this system that stretches from the Potomac River to the Ohio River and all points north of Gasaway, we underwent a serious look at how we should brand ourselves, how we should be able to project ourselves to the public, to those individuals who trust us to walk through those doors. And one might say that the West Virginia United Health System is too many words. And as part of that, we went through a systematic a review of how we should put forth the value to the citizens of West Virginia, to be able to unify us in terms of a corporate brand, but also to be able to transmit that we're about quality, that we're about high-quality regional health care, we're about patient-centered care, wherever you are in the spectrum of care. And we came up with our new logo, our new name, WVU Medicine. WVU Medicine is how we will be referring to ourselves moving forward. And it assumes the two things. One is the historic relationship with West Virginia University, the fact that we're offering high-quality health care and medical health care, but also it represents that, as you see, that there's co-branding, that it also acknowledges the importance of the regional healthcare system that we have. So for this part of the state, it will be WVU Medicine Camden Clark. At Morgantown, it's WVU Medicine Ruby Memorial Hospital. Out east, it will be WVU Medicine Berkeley Medical Center. And we believe that by bringing together a larger vision of what we are and who we serve, but respecting and honoring and incorporating the regionalization that occurs in our state, that we have been able to brand ourselves as the largest, most effective healthcare system in the state that will transform lives as we move forward. So on behalf of the 11,000 employees that work for WVU Medicine, the physicians, and for the over 1 million patients that we saw last year in outpatient settings and almost 50,000 admissions, we thank you for coming here today. We thank the communities for your dedicated support of this hospital, the importance of this hospital to this region, and we look forward to a bright future where WVU Medicine will lead the way to provide transformative health care to the patients who come through our doors. So thank you very much. I look forward to seeing you all in the future.
Thank you, Dr. Splenda. There's so many people to thank for this project and for the success of our organization. It starts with our elected officials who helped us pave the way to get the certificate of need we needed to be able to merge the two hospitals together and then advance the hospital here on this campus. To the board has been so supportive of us through the years and really becoming state-of-the-art, to reinvesting in our organization and reinvesting and merging with the system to be able to provide us the additional support we need. To the system itself and Dr. Kalinda for their support financially and clinically. Financially in helping us to attain the money that we needed to get to be able to do the expansion, but clinically the link to the university and the link to the higher level of education and the resources that are available to us through the system. To the staff has been great through all this. They've been great through the reorganization, through the merger, through the consolidation, through all the building projects. Without the staff support, we would not be able to do what we do every day. The physicians that care for our patients, and that we're intimately involved in the care of the patients that merge between the two hospitals, but also intimately involved in the design of our new facility. And lastly, to the community itself. Without the community support, we would not be able to be the organization that we are. We cherish that relationship. We want to foster that relationship. And we want to make sure that we provide the care that we need to provide for the patient population of our area. I talk about everybody that's involved in the healthcare arena and part of our organization, but the individuals that are now building the facility are important too. And we partnered not only with Pickering and Associates to help us with the design and engineering, but also with all of our local trades. And I'm proud to say that we are using all local trades for our building. We've not brought anybody in from the outside. We've made sure from day one that we were using local trades, even with all the renovations that we've done, but now with the expansion. Because they are our patient population, the families that we care for, we want to make sure that we support them too. So, that being said, we are going to do a groundbreaking ceremony across the street. I asked our clinical folks to be part of that groundbreaking and really be the cornerstone of that. We have Dr. Brian Richardson, who's our director of our emergency department, Susan Abdallah, who's the director, Dr. Richardson being the medical director, Susan being the director. We have Tom Mars back in the back, who's our chief nursing officer, and Tammy Powell, who's our director of nursing. These are the linchpins and the cornerstones, not only of the design, but also of the care of our patients. And I wanted to make sure that they were right out front when it came to the groundbreaking. So, if in an orderly fashion, we can try to make our way across the street, and as the mayor said, there's 40,000 plus cars that travel this road every day. And we can with all the noise. Just be careful, and we'll try to block off the traffic as best as possible as we cross the street to the official groundbreaking as a photo opportunity. So, that being said, thank you very much for all being here. Thank you for braving the noise and being out here in the outside, and we'll head across the street now. In closing, again, thank you all for being here. We do have refreshments in the main lobby of the South Tower here. So if you want to make your way down to the walkway, you can go into the South Tower and